What are the worst side effects of prednisone? I came up with a list of the 9 worst side effects of prednisone based on 3 different scientific articles. And I'm Dr. Megan, your prednisone pharmacist. I personally had to take prednisone, and I don't necessarily agree with it from my experience, but here are what scientific articles show people and doctors perceive to be the worst side effects of prednisone. And we're going to go from the least worst to the very worst, so that at the end, you'll find out exactly what people and doctors perceive to be the very worst side effect of all. I wonder if you can guess. Type below what you think it is. So, the 9th worst side effect of prednisone, according to several studies, is sleep disturbance, which I call insomnia, and is actually the number one most tweeted side effect of prednisone that people feel they can talk about on Twitter. This came from a study of 150 patients where they did a survey of what people thought were the worst side effects. And sleep disturbance came in as one of the top 3 worst side effects. Number 8 worst side effect of prednisone in that study was considered to be skin thinning and easy bruising, changes to the skin. Not everybody gets this, but those who get it, it's miserable. Having thin skin and having skin that looks like it's bruising, even though the bruises might not even be painful, but you might have skin that's just covered in bruises, or maybe even skin tearing because the skin is so thin, it's like paper thin. And that's pretty horrible when you just brush up against something and suddenly the skin on your arm peels off. Nobody wants that. So that was number 8. Number 7 is infection. So this came from the European League Against Rheumatism Task Force. It's a whole bunch of doctors across Europe who looked at the scientific study to see which are the most worrisome side effects of prednisone. And they are thinking these are bad because they can lead to death. All right. So that's their perspective is as a doctor, I'm worried about this. And so infection was the next worst thing, according to them, because when taking prednisone, you have a much higher risk of infections like pneumonia or sepsis, which is like a full body infection and or massive organ failure. Number 6 worst side effect of prednisone is cardiovascular disease or heart disease complications. This can be anything from high blood pressure to heart rhythm changes to high cholesterol, just the damage that prednisone can do to your entire heart and vessel systems. That's what doctors consider to be the next worst because people can actually die of this. It's possible to have your heart beating wrong in such a way that it can cause death. And so heart attacks, strokes, all of those are possible side effects of prednisone. Not likely, but most people who take prednisone get high blood pressure. Others, like severe complications that are cardiovascular, are not as likely. The 5th worst side effect of prednisone is hyperglycemia or high blood glucose or diabetes. And this makes sense because the class of drugs prednisone is in is called glucocorticoids, meaning glucose, meaning sugar. And so prednisone, the first way they were able to classify it was as a drug that affects sugar metabolism, the way your body uses sugar. It's causing high blood sugar, and that can lead to diabetes, and diabetes can lead to other complications. And so that was a worrisome complication to the European rheumatologists. Number 4 worst side effect of prednisone is bone loss. So bone loss is also potentially leads to osteoporosis and fractures. So bone breaking. So people can break their hips, their wrists. The bone can become so thin and fragile that the bone in the spine can shrink and be compressed, and people can get shorter. They lose their height. And this is an irreversible side effect of prednisone. It doesn't just go away when you stop taking prednisone. And so it's something you really need to pay attention to and take, preventative action against. For example, both the Americans and the European rheumatologists recommend that everyone taking prednisone also takes calcium and vitamin D alongside it because of such a dramatic loss of bone density while taking prednisone. So those were the 4 worst according to the rheumatologists: bone loss, hyperglycemia, cardiovascular disease, and infection. And those are all very harmful and potentially fatal complications of taking prednisone. But people actually taking prednisone don't perceive them as the worst side effects. And so I want to share with you as the most perceived worst side effects, what people are actually going through, what is actually generally commonly experienced by people as the worst side effects, instead of statistically in studies of large amounts of people, what are the worst side effects. So these next 3 are based on patient surveys of people who actually take prednisone and have to do so for long periods of time, or they can have terrible diseases, like they can go blind or they can experience incredibly painful situations. And so taking prednisone is an absolute necessity for them. And so they really know what price they're paying. They're getting this benefit of not dying or not going blind, but this is the price. This is the worst price that they perceive that they're paying. So the third worst side effect, according to people who actually have to take prednisone long term or even short term, is mood changes. So that's anything from anxiety and panic attacks to depression to paranoia to psychoses to just feeling wonderful. That's called hypomania, and just having lots of energy. And it's a roller coaster. Prednisone can cause mood changes that are a roller coaster. And they can be wonderful and they can be really horrible and really debilitating. And those mood changes to doctors aren't that bad. They're not that threatening. They're not as likely to die, although suicidality is a potential risk from prednisone as well. But for people actually taking prednisone, suddenly having anxiety and panic attacks where you've never had them before, not being able to sit and watch a movie with your kids because you can't sit, like you just feel so nervous and jittery, to having really short temper before you normally had you were able to be calm in situations, and now you just fly off the handle instantly. Those are perceived to be the third worst prednisone side effect because they affect so much of life. They affect your relationships. They affect probably your spending habits. They affect everything. Like your mood affects everything. And so that's the third worst that people perceive. The second worst that actual prednisone patients perceive to be the second worst side effect is weight gain. And I personally experienced this. I had just barely finally lost the weight gain from my third pregnancy, and I was finally feeling good again. Finally looking like myself after having my baby when I was prescribed my prednisone that I took for 8-9 months. And I started gaining the weight back, and it looked like I was pregnant again. And it was hard for people to just decide, is she just struggling to lose the baby weight now, or is she pregnant again? And it was this awkward, like, what is going on with you, Megan? And so weight gain is not fun. And it's the worst because it's going to the least flattering places, such as your belly. And it can also, the fat redistribution can also deposit fat on the back of your neck, torso, and it's horrible. The torso and the back of the neck. And I have a whole bunch of videos all about prednisone weight gain if you want to know more about that. But that brings me to the number one worst side effect of prednisone, according to multiple patient surveys. And it's a form of fat redistribution. And it's not the belly, and it's not the buffalo hump. It's the face. It's the moon face. It's going from having defined jaw lines and wrinkles to suddenly having no defined jaw, having just roundness, fat deposited from here to here. I personally had moon face, and it's so hard because you don't recognize yourself in the mirror. People don't recognize you. I had a guy who said that people didn't recognize him on the street, and they said, "Hey, you kind of look like this guy I know." But they didn't think he was the same person. They thought it was like maybe his brother. And it's also discouraging because for me, for example, trying to do Face ID on my phone wasn't working. My Apple iPhone didn't recognize me. That was depressing. And so That's why it's the number one worst side effect of prednisone, because it's the one everyone can see. The rest of this, you can maybe hide the belly weight gain with a well-tailored outfit. Nobody needs to know that you're suffering a panic attack. Nobody can tell you're having bone loss, including you, until it's too late and you have a broken bone. And you don't worry about heart disease or infections until, they take you all the way down the road. Those things you don't think about or worry about, and you don't see them. Whereas moon face, you see on a daily basis every time you see yourself in the mirror. And that's why people perceive moon face to be the worst side effect of prednisone. Now you know the 9 worst side effects of prednisone. And if you're wondering how to avoid the top 7 mistakes people make while taking prednisone, I have a prednisone checklist that includes how to avoid the top 7 prednisone mistakes that people make and how to feel like yourself again after taking prednisone so that you don't have to suffer going through so much. That there are things you can do to counteract these side effects, to prevent them, to lessen your risk for them becoming full-blown horrible side effects for you. So you just download the prednisone checklist by clicking the link below. Just fill it out. I'll send it to you via email, and you can print it out, take it to your doctor, say, hey, we need to check these things to make sure you're doing all that you can to feel like yourself again while taking or after taking prednisone. Signing off as Dr. Megan, your prednisone pharmacist.